Hey, I'm Dr. Barak Meraz with Carpe Diem Chiropractic. We're a chiropractic office that takes care of not only pain, but actually correcting the problem so the pain doesn't keep coming back. Today I'd like to talk to you about the 5 main causes of most people's backaches. The biggest one I see in the office really is disc herniations. How do you get disc herniation? Most people just come in, they say, I just bent over, picked up a leaf or a pen or a box, and all of a sudden I couldn't move. The reality is that the problem's been going on for a long time, causing a lot of pressure to the spine and to the disc, and all of a sudden it creates a disc herniation. 60% of the population have a disc herniation and have no idea until something like that happens. So what exactly is a disc herniation? Is that when there's so much pressure to the disc that the disc pops out, that puts pressure on the nerve, and that nerve goes down your leg, called sciatica. The second cause of low back issues is improper lifting. A lot of people just want to get it done, so they go and move things, move furniture, move boxes, picking up things that fell off the floor, and they're using their back instead of their hips, legs, and joints the way that it's meant to be used. So we want to make sure that you're lifting properly. Now, if it's a muscle spasm or muscle injury, the pain should go away in less than a week. If it's lasting longer than a week, it became a disc or joint issue. Go see your chiropractor, physical therapist, or doctor, because the faster you go get it treated, the faster it goes away. The third cause is sports. If you're an athlete, doesn't matter what it is, football, basketball, baseball, bowling, corporate athletes, people that sit in the desk all the time. If you're doing the same thing over and over, called repetitive injuries, you're gonna create a lot of muscle imbalances. That creates a lot of low back, neck issues, any type of issues really, depending on what you're doing most often. If you're a baseball player, most likely you're gonna have a shoulder and neck injury. If you're a football player, neck, low back injury. Bowling, twisting at the hips, low back injury. So sports, if you're an athlete, go get a chiropractor, go do therapy, make sure you're doing the proper exercises, and there are exercises that are gonna make you better as an athlete as well, so learn about those. The fourth cause of low back pain is sleeping. We're sleeping usually about 6 to 8 hours a day. You want to make sure that you're properly sleeping in the right position. Most people actually sleep on their stomach. That when you're sleeping on your stomach, you're rotating your neck, you're rotating your hips, you're putting pressure on your shoulders. You do not want to sleep on your stomach anymore. You want to lay down on your back. Make sure you have a cervical pillow to keep that arc in your neck in the proper position. And make sure that you're putting a pillow under your knees. That's going to decompress your spine while you're sleeping. If you're not going to sleep on your back or it's not comfortable, you want to sleep on your side. When you're sleeping on your side, make sure that there's a pillow that's about this thick, because you don't want your head down or up. You want to try to keep it level. While you're sleeping on your side, put a pillow between your knees and hug a pillow so your spine is straight and you're not rotating. If you can do those simple things, that's going to decompress your spine while you're sleeping, and you're going to wake up with a lot less pain, a lot less discomfort, and more mobility. The fifth and final cause of low back pain on this video today is talking to the people who are immobile, those who are not exercising enough. They're getting what's called osteopenia or osteoporosis. That's the weakening of the bone structure itself in all the joints, especially in your spine. That's going to create a lot of back pain. When the bones get weaker, the muscles have to engage more, creating a lot more spasms and muscle aches, and they last a lot longer. If you're having low back pain and it's chronic and it's not going away, go make sure you do not have osteopenia or osteoporosis, because it will get worse. In order to stop that or prevent that from happening or build the bone back up, you have to exercise. We're made up of 206 bones, 650 muscles. We're not meant to sit in a desk all day. We're not meant to sit and watch TV all day or stay in a position in the same all day, right? For those of you who work to do the same thing over and over again, you have to move. I hope you learned something from these 5 causes. If you have any questions or comments, leave a comment below on this video. I'm Dr. Barak Meraz with Carpe Diem Chiropractic. We can help you seize the day, not your back. And I highly, highly, highly recommend, if you are having chronic back pain or even acute back pain or even just got surgery, SUPMOGO is a phenomenal tool. This actually engages the muscles on a cellular level to the intrinsic muscles, the small little muscles surrounding your spine, to engage those. If you can engage the small muscles in your spine, you're way ahead of the game. You're gonna get your not only back pain out, but you're gonna correct the muscle structure surrounding the spine to help relieve it forever. Awesome tool. Thank you for watching. I'll see you at the next video.